Hello, my name's Dr Ollie Hart and I'm a GP and a director at Peak Health Coaching. We believe at the moment it's never been more important to reconsider person-centred care and make sure this is a key way the NHS works. And we love this definition that came from the Health Foundation a few years back. We're talking about the three key components of person-centred care. It's personalised. We want to make it individual to people's contexts and their capabilities and skills. We want it to be coordinated and joined up. But crucially as well, we want it to be enabling. And I think sometimes that gets lost, and I'm just going to focus on that briefly in this presentation. Of course, we always want it to be wrapped around with dignity, compassion and respect as well. So I don't think you get any person working in the NHS or in healthcare that doesn't think of themselves as person-centred. They always talk about the person being at the centre. They think about the person. But often what we do is we apply our approach. So we give people advice. We use our experience to suggest what we think is needed. Very well intentioned and from the years of learning that we've had, but very much it's ours. And we give direction and we apply our knowledge and skills. And whilst it's very well intentioned, if we're not careful, what that can do is it constrict the person's ability to think for themselves. So everything's done to them, but they're not thinking well. It becomes a professional's thinking inwards approach. So let's contrast that to what we call the professionals thinking outwards. Again, the person's at the centre as the focus of our attention. But now what we're trying to do is use all our skills to understand what that person's fears, hopes and expectations are, to take time to understand and learn. We understand their context and we tailor our care to best fit their context and capabilities. We understand what matters most to the person and we value and encourage their skills and knowledge. If you like, the locus of control is as far as possible with the person themselves. Now, of course, that will vary depending on people's skills, and we can be very clever about how we do that and make sure it is most appropriate to their situation and their skill sets. But nevertheless, it is a different mindset where our focus is on helping the person to grow outwards themselves. And we call this a person thinking out approach. So right now, whilst we're building person-centred care back into the NHS, I think it's really important that we make sure that dynamic is right and we're growing the role the person takes. And we know that if we can do that, people become a huge asset, not only to themselves, but to the whole NHS. And right now, we really all need that.